Hey friends, welcome back. My name is Jessica and I'm a board-certified pediatric nurse practitioner and a first-time mom. Today we're going to talk about something every newborn comes with. Nope, it's not adorable cheeks. It's not the ability to keep you up all night. It's the umbilical cord stump. Yeah, that little shriveled thing that looks like a raisin in the belly button. We're going to talk about that and everything you need to know. Let's get to it. So first things first, what even is it? So when your baby was living that good life in mama's belly, the umbilical cord was their personal room service. You can call it Uber Eats, you can call it DoorDash, you can call it room service in the hotel. They are delivering all that oxygen and nutrients from mommy and then also getting rid of all the waste. So when baby is born, they clamp and cut that cord and leave a little stump. That's the umbilical cord stump. So how do you take care of it? Good news, you actually don't have to do much. In fact, the motto here is clean, dry, and leave it alone. Keep it clean. Even if it gets dirty, that's okay, baby might have a blowout or two. Just clean it with plain water and dry it with a clean cloth. Number 2, keep it dry. Air is your friend. And with that, what you can also do is fold the diaper. So this is the back, right? And then this is the front. Fold the diaper like this, so that you allow the stump to kind of have some more air and leave it be, and also prevent this rubbing going on the stump and also soaking that stump. Prevents infection. And lastly, leave it alone. I know. When it starts to look crusty and just half hanging, you're going to be tempted to kind of just give it a little push, give it a little help. But resist. Let nature do its thing. Remember, no picking, no pulling, no tugging. Okay, so what should you expect as it heals? So the stump will dry out and then change colors. It'll be your yellow to greenish color, then to brown, then to black. Looks kind of gross, but totally normal. Then it'll fall off week 1 to 3 after birth. You might expect some bloody drainage or a wet area underneath there. That's completely normal as well. Just kind of think about it as a scab falling off. Now here's where I want you to put your detective hat on, because there are a few things that I do want you to take seriously. Number 1. Any sort of redness that's spreading around the belly button. Number 2, any swelling or warm area around it. Number 3, any pus formation, so a thick yellow greenish fluid draining or oozing out. That's a red flag. Number 4, any foul smelling odor. So not just a diaper change odor, like something's really not right odor. Number 5, any fever above 100.4 Fahrenheit, you really have to call your healthcare provider. And lastly, if the stump is still hanging by a thread or still hanging there or still there for past 4 weeks, call your provider. In some cases, your provider might also mention something called umbilical granuloma. So this is just a little pinkish tissue that might stick around after the stump falls off. Good news though, it's minor. The provider can easily take care of it by using these silver nitrates. Not like a Disney type of thing, but like just a little thing like that. And then it'll kind of cauterize that area and, let it heal faster. Thanks for hanging out with me today. If you found this helpful, please don't forget to like, subscribe, and click that little bell so that you don't miss any more quick, clear, and judgment-free baby care tips. You've got this. Before you know it, that little belly button will look picture perfect. See you next time.